Testing, testing. Okay. Testing, testing. Testing, testing. All right. Bobby and Katie's office. It's up and running. Rod's already up on policy. And yeah, leave my computer. Sorry, Doc, I can't hear you. What'd you say?
Lucy, you changed places. I can't hear you.
Yes, I changed places because I was getting too much light from me in the background.
Oh, yeah.
So now I'm in the kitchen.
You made it real dark where you were.
I know. That's a bad spot for this. So I'm in the kitchen now.
It is cooler out there.
I was gonna say, should I continue? Are they already on for policy? All right, I gotta get in.
You got a few minutes.
Well, it's now 88 degrees in Presque Isle with 43% humidity, but no rain.
I knew somebody from a previous church who moved up the press aisle.
Really?
Yeah, he moved up there years and years and years ago. Fred and Linda Witter.
There's a lot of Rockford people up in this area.
These were from Chicago.
Oh,
And yeah, they were in a remote spot, but I imagine everything up there is remote.
yeah. It's funny, you know, we always refer to it as we're in the woods, but when I was in Sweden, they always refer to it as the forest.
Uh-huh.
Which I guess technically this is a forest. Yeah.
Yeah.
Mosquitoes are healthy this year too.
Ooh.
What do
See,
we
we can get Lafa to smile.
That's what my picture is for.
I know, that's a good picture. But it must have been one of those few moments where we get you to smile. But now you're smiling. That's cool. Is it okay where you're at in your office? Because the health department likes it warm.
Oh no, it's nice over here.
Okay, because they have air conditioning problems right now.
Oh no.
Yeah, so Christina's over there in her bathing suit with throwing water on herself and trying to stay cool, and fans blowing, lights are off. Oh my goodness. Work in the dark.
You should not be working under those conditions.
She just laughs. Hey, the gang's all here
Again.
again.
Yeah.
Except Angie.
Yeah, see, Angie's not here.
Christina, is Angie coming, do you know, or? Yeah, okay. Lafa, we had a question at the last meeting, and you'll probably be asked it by Sandra. In the flu policy, it doesn't mention the Board of Health members. But one of the terms used for coverage is volunteers. And I'm wondering if volunteers covers appointed members of county boards? Or is that talking about people that come in to help out in the department? Like, you know, volunteers for passing out pamphlets or whatever.
I have not looked at the flu policy, so
Yeah,
I don't know.
so whenever you get a chance to see how that stacks up,
Okay,
thank you.
you're welcome.
We got a few months before flu season, don't we?
Yeah, then I have to make a decision if we change the policy.
Or you could wear a mask.
I'm not doing that. I've worn a mask enough in the last year and a half. I'm
I
not wearing
know.
it to meetings if I don't have to.
No, I just keep one in my purse in case. You never know when you go into a store. If you know, usually there's a sign out front that says if you're fully vaccinated, you don't need to wear a mask.
Well, they haven't changed anything, and I went to the dentist yesterday, and half the people coming in didn't wear masks. And that's a
Yeah.
medical facility, and you're
Yeah,
supposed to wear a
surprised.
mask going in. And I was only there for an hour and 15 minutes, and I saw 4 patients without masks. So
Wow.
you know they're not going to say anything.
No.
So I think people think it's already changed.
Well, I think,
Oh, your sound's off.
She didn't. She didn't. I read her
Christina,
lips. She said she didn't do it.
I didn't do it. Christina did it. No. Yep, you're back.
I did try to unmute and it didn't work. So
Huh.
Yeah.
that was my issue.
What were you going to say?
What I was going to say is, I think that people have been, in my dentist's office, they would confront you.
Oh, you got a tougher dentist.
Well, the policy for any healthcare setting
Yeah.
is, I went for a pedicure and they make me wear it. So
Oh, yeah. Karen goes to a salon and for all the stuff there, she has to wear it.
you
Yeah.
have to wear them. So, you know, I'm used to it.
Right.
It actually felt kind of
Yeah.
weird the first time I went into a store without it.
Yes.
I have
It's like
been
having
done that.
forgotten your clothes.
Yes.
I haven't done that yet. I don't know. I'm not up to that yet. Well, we got everybody here. I think Angie's here, right, Angie?
She's here.
I just don't hear. There she is. All right, so we have a quorum and it's 4:31. We'll start the policy committee for June 9th. I need approval of the agenda.
So moved.
I'll take that other one as a second. All those in favor?
Aye.
Opposed? Okay, hey, we have this new thing that we only heard about an hour ago. COVID-19 mitigation for individuals working for WCHD. Do we need to explain this again?
Well, Angie wasn't at the other meeting.
Yes, to Angie.
Yeah.
I read it. Sounds good.
Oh, maybe we don't have to explain it to Angie. Sandra, anything you want to say? You got to turn your mic on.
Do we need to change? We need to let her know our discussion?
Yeah, I think it would be important for Angie to hear the discussion that we had. It was presented earlier, Angie, at the Personnel Committee, not because, just as an advisory, because the Policy Committee was the one to officially advance or forward. And there was quite a bit of discussion related to this. And it, again, and the policy was generated out of the Equal Employment Opportunity Commission came out with a ruling on, I want to say, May 24th. It was May 28th, that indicated that employers could ask vaccination status and could mandate vaccination status and put in additional, procedures or policies that it did not conflict with the equal employment opportunity laws that were in place at the, really from the federal level. So part of the discussion working through the leadership team was as we bring more people back into the in-person environment, and again, as we open up as Friday is the introduction into phase 5 of Restore Illinois, about the conditions and procedures for vaccinated versus unvaccinated staff. And so worked through to develop this policy. It was mirrored in some ways after the influenza. Obviously, there are some differences about this. This is a 2-dose vaccine, and went through the procedure about it. Basically, if you're not vaccinated, then you will have to be required to social distance and wear face coverings, which is really part of the general guidance that's been put out by the Centers for Disease Control and Prevention. I think what it changes in the work environment, it's not just an honor system, right? So when I walk into Menards or any other location, nobody's asking me my status. If I'm not vaccinated, I'm supposed to do the right thing and wear a face covering, right? And maintain social distancing. And I just came off, between board meetings, I was also on the school policy committee at the state level about looking forward as we move forward on this. And again, looking at whether or not they'll mandate it as part of school code. The challenge they have is the ages yet are not there. So this would require any individual to identify that they've been vaccinated or not. Their supervisor will be responsible, and if they're not, they would wear a face covering in the environments. Now, some things would never change. If you are employed on the 4th floor, if your primary function and role and responsibility is clinic, you're wearing a face covering, and any of us who would go up into that environment, because that's a healthcare setting in the traditional sense. So for instance, environmental health, if they're fully vaccinated, when they're going out to do inspections and field work, would not be required to wear a face covering. If they're unvaccinated, they're required to, and in addition to maintaining social distancing. So you can see that we're all still required to, disclose our status. We still are supposed to hand wash. I think it's a good thing. Stay home when isolated if you develop symptoms, regardless of vaccination status. And wear face masks in the health department in the designated clinical areas. And right now that is the 4th floor and any of our mass vaccination or any of our vaccination sites. If you're unvaccinated, you wear masks indoors and outdoors during WCH, including our parking lots, while conducting business on behalf of the Winnebago County Health Department. They have to remove it while they're eating or drinking. And they can certainly do whatever they like, or they should supposed to be following by the honor system, the recommendations of the Centers for Disease Control and Prevention on their off hours. And the other thing that's very different for them is they do have to quarantine if they're exposed to a case. So versus an vaccinated individual, I apologize. So that was the kind of the discussion and gist. Ron pointed out that probably had never been asked about flu. And so looking at that policy as well, probably is a companion piece.
As being a lawyer, I think I just shot myself in the foot an hour ago. So, but I can't let that slide. I have to deal with this stuff logically, and it didn't follow logically. And the policy is vague, and I know it was always applied vaguely. I was never asked to get a flu shot. We did not ask for declinations or acceptances or paperwork or anything, and it doesn't say Board of Health. So I already mentioned it to LAFA, and she could look at volunteer and what that means as far as the state is concerned in any court cases. I mean, I don't have access to any of that good stuff. So other than Google. And I don't think we can cite Google all the time as a legal resource. So questions, comments about the policy? Suggestions? I think we should exclude all.
Ron,
board
I
members.
with those, for the people who cannot receive that shot because of health conditions,
Right.
How do they handle this?
Wear a mask.
Mm-hmm.
That would be their only thing that they can do. Now, some of them have asthma so bad they can't even wear a mask. And I really feel sorry for people who I have cousins and other friends who are or have been told by their doctors, don't you dare get that shot because it would, it's not, you would just have a horrible time because of all your allergies and everything. So I worry about them, especially when they get in a crowd and people start teasing about, why are you wearing a mask and this type of thing. I think we also need respect for those who do wear a mask and not rag on them of, why are you still doing that? You don't have to do that. And so I don't know. I just feel bad for them.
I had the same situation in my family with a son and a granddaughter, and they've been told by two different doctors to not get the vaccine because it will just worsen their condition.
Yeah.
And that there'd be nothing that the doctors could do for them. So I had that same situation, and they're going to be ostracized, or they're going to be, it's like wearing the Star of David, in World War II. I mean, it's not going to be pretty.
Well, I think that first of all, one is that there will be other conditions, and there's going to be campaigns coming out on another level about masking, right? That we're not going to mask shame because there are individuals who've been vaccinated that will continue to wear masks. Think we just told you the healthcare workers, right? So when you come into our building and you go up as a clinical patient on the 4th floor, you'll be wearing a face covering in that scenario. You've got individuals whose immune systems, we're vaccinated, may have other conditions. We don't know how robust their intake or their uptake of the vaccine or how protective it is for them. And they will continue to choose to voluntarily mask beyond that. There are individuals, if you're going into a mixed crowd, there is recommendation that, if you're not sure, it's kind of like when in doubt, you want to be wearing your mask because these vaccines are highly effective, but they're still not 100%, right? So I think that we have to be respectful on both sides of the equation, but in a work environment where we are responsible for the health and safety of our employees, taking the reasonable precautions. And that's part of the school's discussions, right? I mean, that's 6 feet of social distancing. Some schools can't maintain that. If the kids aren't vaccinated, they got to wear a face covering because, otherwise they really are in closer proximity. And, the transmission rates are much higher in that population. So again, it's not intended to ostracize. It's really intended to make sure that employees understand that if you're not vaccinated, you'll wear a mask. And if you're in this building and you're going up to the 4th floor doing clinical, you'll wear a mask regardless of vaccination status. But everyone should stay home, right, if you're sick. And we're still going to have to work through this because I noticed we don't have as many commercials for NyQuil and Theraflu and all that good stuff to power through the day. Really trying to get people to understand that we really want to stop the transmission of any respiratory borne illnesses amongst, as we know, a cold goes around an office 3 or 4 times. And so really trying to help on that protection.
I read recently, and I think it was the Wall Street Journal, that flu during this last flu season was down 99%.
Yep.
99%. Much more effective than the flu shot.
Guess those masks work.
And that's been the debate about, I hate to say it, the debate in the schools is about, there are planned protests for Thursday against health departments. We don't know whether we'll be one of them. About letting kids breathe free, like allowing them to remove their masks under all conditions. And, we're debating this at the state level with all the policymakers about how do we manage not knowing everything, right? This year was hybrid, so we were at 6 feet and masks with no vaccine at the start, right? And we were really able to keep transmission rates low. And it's that layering that we've got. So now we've got vaccines. Which one should we take off first, right? Is it the social distancing if everyone's vaccinated, right? So that, your son or, can't sit, in a classroom with the rest of us who are vaccinated, we spread it to that person, right? Because he's the one that's unprotected, or your grandson. That's the challenge that we're faced with. And protecting the vulnerable. And so we're going to have to really destigmatize that whole concept of I'm wearing a mask potentially for myself and potentially for you, right? And what does that look like as we head into the fall and as we go indoors? So I'm saying enjoy your summer months at least. I think vaccines have been a game changer under this particular illness. At some point, and I know Peter is putting some slides together. As our vaccination rates have increased, the number of individuals in, especially outbreaks in nursing homes and deaths, has declined significantly. And so we really, the group that was most at risk benefited the most as well. And so now we've got that middle group that, it's the hard group to get flu vaccine, right? They're young, they're healthy, but they can spread it to just about everyone else. So, we'll have to continue to monitor this and take a look. And to Ron's point as well, Afa, he said, is this forever? I said, well, right now, I guess at least we're reviewing it every 2 years, but if the circumstances were to change, either one, they came and said everyone has to mask, or two, masks have no benefit, or social distancing has no benefit, we would then, review those guidelines and adapt them accordingly.
One thing we've learned in a year and a half, things will change. Requirements will change. Science will change. It will all change. So you can say we're following science, and then tomorrow science says that what we told you was wrong. Here's some new stuff. So what we can guarantee is it will change somehow.
That's the guarantee, right?
Yes.
And nothing else we say is guaranteed. And I think that that's been the challenge with all of this. I mean, what we learn every time, I mean, remember at the beginning of vaccinations that everyone's going to need a booster in 6 months. Now they're saying it looks pretty good for beyond 6 months, maybe a year at least. And then now they're going to take a look at some more data coming out. And I was just kind of got a little blurb that Pfizer has started the trials on the 6 month to 12-year-olds.
How do you get volunteers for that? How do you get how do you get parents to volunteer their kids for that? That blows my mind.
I think you get very committed individuals who have faith and trust, which not everyone has, right? That the appropriate precautions and steps will be taken.
Yeah. Wow. Any other? Yes.
I have lived long enough that I can remember just taking my kids so they get their shots. I didn't question it. Polio, when the polio shot came out, and if you had children, how many of you took your children to get the first polio? It didn't even come in a shot. It came in a sugar cube to make sure your kids didn't have it. We had more trust and worried about our children not getting things. And do they even vaccinate them anymore for smallpox? We've been through all that. I still have the scar from smallpox vaccinations. So, there's always going to be something new coming up. And it will always be something new coming up. And so the first person I wanted to protect is myself and my children. But other people just think it's the government's trying to kill you. Where all these ideas come from, I have no idea. But
Well,
the majority of us stay sane and do what we're supposed to do.
Whether we like it or not, there are instances of the government killing you, doing stuff that maybe wasn't the best thing at the time. But and there was a polio vaccine before the one that worked that gave all the kids polio, and it was pulled back. So a lot of this is experimental, and unfortunately, if you get caught in the experiment stage, you might not come out that great.
Well, by now we should be past that experimental stage. In fact, COVID has been around for a long time, from what I understand, and they've been working a long time to trying to find a vaccine to take care of this. But then all of a sudden it popped up all over the world and put us on page one. So, we have to be trustworthy someplace.
Maybe our challenge is, can we mutate as fast as the virus?
Yes.
Yeah. All right. Anything else on the policy? I think we need a motion.
You want a motion? I'm happy to make one.
Okay.
I move that we forward this to the Board of Health with a recommendation for approval.
Okay. Is there a second? All right.
Second.
Any other discussion on the policy and the motion? Okay. All those in favor?
Aye.
Opposed? All right. We will pass the policy on to the board next week. A question arose, Sandra, before you came on the last meeting. We're not in person next week, are we?
My understanding from Christina, that from all of you, that you were in person next week.
We are in person next week.
Yes, that your
Okay.
committees were going to be remote, and that, but again, and you were going to have your board meetings in person. But is there a challenge with quorum at this point?
I won't be there.
Will you be available by
Oh, sure.
Zoom?
Oh, yeah.
Okay.
But that's not a quorum then. I mean, she can't go towards the quorum, right?
Well, the executive order has not been lifted yet,
Okay.
right? Right. A lot of that, they're still allowing, and I believe that they're still actually considering over the long haul, aren't they?
Correct.
Maybe you can give a little more guidance on that on the board, on the Open Meetings Act.
Correct, because the county board is still hybrid as well.
So, I mean, if we can send out a poll, and if you'd prefer to remain remote for really, I'm going to say for a convenience of participation, right? It's not under COVID regulation. We can certainly meet the standards and guidelines, right? Because next week, definitely there's no capacity limit on rooms or that. We can certainly query and poll the board and find out if that would be preferable. Would you prefer that for us to send
Yes.
out?
Yes.
Sure.
We
Okay,
did,
Let me make it, I want to be clear. What is it you want to do?
As the board members, would they prefer to be in person?
Okay.
And the hybrid for us will be a little more challenging when they say hybrid, because they have cameras at the county board meeting, and then you can do both. For us, it will be a little more challenging. It's not to say that we couldn't. I'm not sure what the experience would be yet, because our camera system in 115 is not that great. So we haven't really advanced beyond that. But if you prefer, if the group prefers, the majority prefers remote, we would just conduct the board meeting remotely.
Okay. Yeah, I think that'd be a good idea to ask.
And maybe I've got finance following this. I guess I could ask you right now and get.
Right. I would prefer to do it remote, and that would get Lucy into the meeting and not on a screen somewhere. And it might help with our quorum.
Yeah, because I believe Mr. Powers is not available for the board meeting, correct, Christina? He's out of town.
But he could go on Zoom.
I don't
He'll
think.
be back next week,
Okay, he'll be back next week. Okay.
but he'll want to do remote.
Okay. How about the rest of you? Pat, Bob?
I prefer
Yeah, I'm
remote.
good. I'm good either way. But yeah, I think part of the question as we look at summer is many of us have some amount of travel or trip or something.
Right.
I know if we have in person, I will miss July.
Okay.
I will too.
Yeah, it may be a quorum issue, and maybe when we were thinking about it, I'm not sure we were all thinking about that.
Right. I think it'd be better. Well, at least sounds like most of us here, we do remote better than in person. And it would
Well, I
help with quorum during the summer, like Pat said.
We have not had, think about this, for our, really since going into the pandemic and the remote, we've had a quorum at all times.
Mhm. In the committee meetings too.
Yes, we have.
It does help.
Yes.
It does help. And, again, they are posted. We've got all the, documents up. I think Todd and I think the other interesting thing is I think for presentations, I like it a little bit better because you can see things a little more clearly on the screens. That's the upside. The downside is, I think the challenge is making sure the public has access to participate and making sure that they are constantly aware that they have the opportunity to participate.
I think they get that opportunity more when it's on YouTube, because we've never got anybody at the meetings unless they had a vested interest in an issue.
Right.
So, I mean, we had open meetings, but nobody wanted to show up there unless they had something on the agenda. This way, it doesn't matter if you have something on the agenda or not. You have a chance to watch what's going on at home. Much more convenient. Well, see what finance says, but looks like this group is okay with staying remote for a while.
yeah.
Yep.
Yep, Angie too. Good.
All right.
Yes. We discussed this at our caucus meeting the other night, and many of us like having our committee meetings on Zoom. We prefer that because then, for me to go down in town and listen to two meetings that I'm not on, I probably wouldn't do it. But at home, I was so happy the other last week that I was able to, for the Committee of Operations and for Finance, that I could sit right here, watch those while they were going on and participate in them. But for me to have to go down, and I would have missed both of those, and it was important that I be there. Even though I'm going to vote on them this coming Thursday, at least now I know what I'm going to be voting on. So, and they're talking about our regular meeting, about us meeting back again, and that's fine by me for our regular meeting. But our committee meetings, it's so much more convenient doing it this way.
Remind me, did we ever vote on this motion?
Yes, you did.
Yes, we did.
All right, good. Because we got so much discussion afterwards, I got lost here. All right, good. Anything else? Look, I guess all that discussion was additions. So we don't need an executive session, I'm assuming.
Nope.
Okay, so we have a motion to adjourn.
Motion to adjourn.
Second.
Second. All in favor?
Aye.
Aye.
All
Wow,
right.
unanimous.
Good seeing all of you.
Yes,
Yes.
and I will have Finance Committee. Angie will be seeing you on the Finance Committee.
Yes, and I have a question to ask of you, Dr. Martell. Do you have some